All right, good afternoon, everyone. Welcome. We're going to go ahead and get started. Thank you for joining us for today's webinar. My name is Karen Bell, and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are based at the Celia Scott Weatherhead School of Public Health and Tropical Medicine at the Tulane University, and we are sponsored by the Robert Wood Johnson Foundation. We are a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. Here at P4HE, we convene these sectors to work together to better understand critical issues related to attaining health equity. One of the ways we do this is by providing spaces for activities to engage with these groups in insightful conversations on very timely topics and promote actionable solutions. Today, we're going to have a town hall. We have panelists who will address your questions on overcoming current and future threats to health equity. Before we hear from our panel, though, we want to hear from you. You all have valuable opinions and insights on health equity, and we want those to drive today's conversation. We're actually going to do sort of a temperature check to see where you all are, how you're feeling about our field, given where we are today. So to do that, we will be using Mentimeter. You can access that by going to your phone or your browser, going to www.menti.com and entering the code 73890128. So you should be able to also use a QR code that might come up on your screen, but I'm going to go to menti.com and put in that code 73890128, and you hit join, and then the first question should show up. And so we're literally, like I said, going to do a temperature check and see how you're feeling. You can say whether or not you feel motivated on a scale from 1 to 5, strongly disagree to strongly agree, whether you feel scared, strongly disagree or strongly agree, whether you feel hopeful or whether you feel stressed. So you can go ahead and, sort of rank how you're feeling. Maybe you're feeling highly motivated at this point. Maybe you're feeling very scared. Maybe you're feeling a little hopeful, and maybe you're feeling very stressed. I'm not sure, but let's all check in with each other really in doing this. Okay, motivated, scared, hopeful, and stressed. Tell us how you're feeling. All right, so we see some responses coming in. The highest ranked is stressed, which I think we all can relate to that feeling, particularly being in fields that are very much impacted by government funding, for example, or living in bodies that are oppressed and marginalized in our society, and feeling anticipation about what the change in administration will mean for that. Some people are not feeling very hopeful, strongly disagree, or I guess 2.2 would be disagree that you're feeling hopeful. People are feeling scared, but also people are feeling motivated. So you can continue to look at that, continue to put in how you're feeling. Just wanted to check, but I think we are feeling motivated, scared, and stressed all at the same time, which I think I totally understand. We can go to the next question, I believe. Okay, this is an open-ended question. It says, what do you need to continue your health equity work? Given where we are in society, in our world, in our country, what do you need to continue your health equity work? I see responses coming in. I always try to participate as well. I'm going to put in my response. You can put in multiple responses. And if you have already put in one response and you see somebody else's comments, you can build on what they say or add on to it. Okay, so I see that a lot of people say we need funding. That is probably more than what we have needed. We will continue to need, and we might need it from different sources than we have had in the past. Support, safety, advocacy from leadership, spaces to speak our truth without resistance or judgment. I think there are potentially more, and we might be able to scroll down, but I imagine that more of them say funding. And I see some people in the chat have put funding as well. Okay. Collective action, research, protection or support, health equity champions at every level, support and openness, partners, collaborators, and co-conspirators, yes. Movement building and solidarity, connection, top-down support, and acknowledgement that this work is critically important, okay? Leaders who appreciate health equity work, policy support, supportive legislation, empathy, connection, community, commitments from key community and non-community members to co-develop strategies for health equity. It's been stressful. My Office of Health Equity was eliminated in June, and I was laid off. As much support as we can give to you, potentially tangibly as well for that experience. Very sorry, and I think that a lot of us will be seeing a lot of different changes, structural change as well. That's probably needed to get to this health equity work that is critical in this time. Protected time, partners, more leadership support, real talk. We can probably end on that one. Yeah, because that is what we will be doing today, is having real talk. Many of you all have submitted questions to the panel beforehand, and we're going to talk about them. We're also going to base some of our discussion as much as we can on what you've just shared. So thank you for sharing and providing your input. As always, we're excited to have you here. Please continue to share your thoughts and comments in the chat throughout today's discussion. If you have any additional questions for our panelists on overcoming current and future threats in health equity, you can submit them throughout today's event via the Q&A feature. It's possible, I just want to make sure we say this, it's possible that we will not be able to answer all questions during today's live session, but they will be addressed in follow-up materials that will be available in our resource library, Actually, for every webinar we have a group that synthesizes everything that is said to come up with like a real document for us to move forward with. And so that, as always, will be circulated with the P4HE newsletter. So with that, we will turn to our panel, and I will introduce them. First, we have Dr. Chris Purnell, who is the director for the Center for Health Equity at the NAACP. Hi, Dr. Purnell. All right.
Good.
Hi, thanks for joining us. Actually, again, you've been on our webinars before, so happy to have you. Next, we have Angela Chalk, who is the founder and executive director of Healthy Community Services. Hello, Dr. Chalk. Oh, you're muted. You're muted.
Okay. Technology. Thank you for having me. And I have to also add that I am a visiting adjunct professor at the Tulane University Celia Scott Weatherhead School of Public Health and Tropical Medicine.
Thank you so much. Thank you for adding that and making sure we have all your information. Thanks. We have Cincy Hernandez Cancio, who is Vice President of the National Partnership for Women and Families. Hello.
Hi, I'm so happy to be here. Hola todo el mundo. I'm Cincy Hernandez Cancio, and my pronouns are she, her, and ella. And I'm really, really happy to be having this incredibly important conversation right now. This is a tough time. There's a lot of tough work ahead of us, and it's through spaces like this that we can advance.
Thank you so much. And last but not least, we have Alma C. Stewart Allen, who is the founder and president of Louisiana Center for Health Equity. Hello.
Hello, good afternoon, and hello to everyone on Zoom, on the webinar. Looking forward to having this important conversation.
Thank you so much. Thank you to you all on the panel and everybody for being here. Also, everybody who is going to follow up and watch. As a professor, as a Black woman in America, this has been a very odd, trying, scary, stressful, anticipatory time. So in your opinion, I think this is to everyone on the panel, given where we are with a pending Trump administration, what are the most pressing health equity issues at this time?
I'll weigh in. So I can answer this first and foremost as a public health and preventive medicine physician, because it's going to frame what I see as the most pressing health equity threats, and then also through the lens of the NAACP and the Center for Health Equity. So we know well in the first Trump administration, because of the policies that were enacted during the height of the COVID pandemic, that public health was under threat. It was under threat through misinformation and disinformation. There was an anti-science agenda, if you will, which disproportionately harmed Black and brown lives and disproportionately led to death in Black and brown communities. The pandemic does not allow us to hide from that statement, that truth, right? That fact. We knew for a long time about these entrenched inequities that were driving disparities, but the pandemic put a magnifying glass on top of that. So as we face a Trump administration to start in approximately 2 months, I am, as a public health and preventive medicine physician, am very concerned. I am concerned about the sustainability of public health, of evidence-based public health. And what does that mean? Public health impacts every aspect of our lives, right? Public health aspects impacts the air that we breathe. It impacts the water that we drink. It impacts whether or not people have access to routine care in their communities. It impacts how society is socially and culturally structured. So I start there as the frame to say public health is under threat. And because public health is under threat, any historically excluded group, community, or population is disproportionately under threat. And through that health equity lens, we are focusing on in the NAACP some of the strategic pillars where we do our work, right? Whether or not there will be an equitable food system, so food justice to counteract the food apartheid that we see, a plethora of unhealthy and not affordable choices in our neighborhoods, and a dearth of healthy and affordable choices, whether or not there will be equitable access to healthcare. Medicaid is definitely vulnerable in these times. So whether or not we're talking about Medicaid expansion or Medicaid availability in the postpartum period, or the fact of Medicaid disenrollments not being checked and counterbalanced, as well as equitable health outcomes, right? We saw disproportionate death and dying during the pandemic, but we also see disproportionate death and dying across cancers, across heart disease, right? Across diabetes, just to name a few. So there's definitely a threat around equitable access to care and equitable health outcomes. And then just the last pillar I'll say, in public health, we say healthy people, healthy communities, and health in all policies. All of that is potentially under threat, right? Because one, how people define themselves, whether they are gender expansive, whether they're non-conforming, whether they are cisgendered, how people define themselves is definitely under threat through what we have seen in documents circulated during the campaign period, such as Project 2025 and others. And this this ruse that talks about DEI, diversity, equity, and inclusion, when really it is anti-Blackness and anti-humanity and anti-humanism. That in and of itself is a threat to health equity. So I'll pause there and allow others to weigh in.
Wow, Dr. Chris, you're a really hard act to follow. I think I 100% agree with everything that you said. The national partnership, from our perspective, I'm going to talk also from the perspective of the organization and from my own personal perspective. The national partnership is really focused on what needs to happen in this country to advance and protect the lives of women and families, especially from an intersectional racial justice lens. And so for us, the biggest threats that we see align very much with Dr. Chris just said, but specifically the assault on women's health and reproductive health and justice. We're very, very concerned about what's going to happen with the maternal health crisis that disproportionately affects Black, Indigenous, and other women of color, and how we already know that the attack on reproductive health is actually making it worse, and that we can't, we don't know how, how we're going to proceed from there. The other issue that we're very, very concerned about is what is going to happen in immigrant communities, because there is, we know, that when we're talking about mass deportation, that is going to break, the incredible stress and strain and damage that's going to do in a lot of communities of color is extremely concerning. And finally, the attack on LGBTQI plus communities in their health and in their rights and everything across the board. As a Puerto Rican woman who barely made it out alive from childbirth, the issues with maternal health, I think, are really critical, and are, and we are, the United States, of all the high income countries, is the most dangerous place in the world to give birth. And that, in the context of a legal landscape that is pushing compelled pregnancy, right, is extremely scary and dangerous when you intersect those two things. And I'm also the mother of a queer kid, and the kind of attacks that we are seeing that are now being, like, the kind of violence that is being normalized against women, against communities of color, against trans and other LGBTQ plus people is extremely concerning as well, because one of the things that we know is that you do not have to be the actual victim of the violence to actually be hurt by it, right? And we're seeing this heaviness and this concern and stress in our communities, especially in our young people who just had their entire lives upended because of the pandemic. They're barely coming out of that crisis emotionally and socially, and now we're seeing this continuing onslaught against them. So those are some of the issues that we are very concerned about in the health equity space, which is really in the everyone is a human, and needs to be respected and have the right to a dignified, safe life, is really what health equity is about.
Okay, let me jump in here. So I am a fourth generation resident of the 7th Ward. And so we have close-knit family ties here in New Orleans, this fourth generation. So I'm relying heavily on what was taught to me in the past by the elders and applying that today. Now, what does that mean? That means that as a community, we have to become more self-reliant on the wisdom and knowledge that's in communities to be able to build the incremental changes that we're talking about. But most importantly, we have to understand what the game is, because right now it is a game, and in how things are termed, for us to even understand what is our role in this. And so for me, I look at also not only the social determinants of health, but the political determinants of health. So what does that mean on the individual? That means that we have to learn how to advocate for ourselves and not take for granted that government is going to do that for us, or that a physician is going to do that for us. It is going to be incumbent upon those of us in communities who are doing work now more than ever to make sure that the needs of communities are met. Black folks are used to doing a whole lot with a little bit. And so we're going to have to go back and to continue to rely on that community wisdom, whether it's maternal child health, access to food care, advocating for better health care in this country. Because even with all of my education and access to health care, I still had to advocate for health care for myself in a current condition that's been over a year. So if I'm being treated like that, think about the folks who have numeracy and literacy issues when it comes to their health care, on how to advocate for themselves. And so it's going to take, and I always say it takes a community to be a community. And now more than ever, we're going to have to rely on each other, whether you're Black, Brown, Latino, Indigenous, gay, queer. We're going to have to rely on our networks to be able to get through the next 4 years and the policies that we know are coming.
And I'll just add to that, I agree with Angela. I agree with all the comments that have been made, but especially the role of community and regular everyday citizens, civic engagement. We know that part of the reason why we are here where we are today is because of low civic engagement, low voter turnout, especially among certain demographics, including the African-American community. And so, you know, it is incumbent upon us to become more involved, more active, more engaged across the spectrum. Also, my organization, Louisiana Center for Health Equity, was established. We're nearly 15 years old now. January will be 15 years. And at that time, the word health equity, which is in our name, was practically unheard of. So we were facing a whole different set of issues, one being lack of education or just plain old ignorance about what is health equity. What does health equity mean? Now, fast forward 15 years later, we know what health equity is. We understand why it is important. The policymakers know what it is and they understand. And if they didn't prior to COVID-19, COVID made health equity front and center. Everybody learned about health disparities and health equity and why an equity strategy, an equity approach is vitally important to mitigating health concerns. So now we're dealing with another set of dynamics, which is definitely not ignorance. It's not a lack of awareness. It's not being knowledgeable about the facts and the data. Now we're talking about just this whole mentality of, I'm going to use the word denial, and denying the humanity of certain demographics. We know that people in certain races are more impacted, adversely impacted. We know that racism is one of those factors that contribute to that. We know that there are other factors that contribute to the poor health outcomes and the disparities. And so now we're going to just simply deny those individuals the right to appropriate care, quality health care. We have to begin to reframe the conversation and call it what it is. And so I think that we are definitely in a different place in time, and the issues that we are up against are very different, and we're going to have a different approach to how we address these issues.
And Alma, I'm glad you mentioned a different approach, because you and I travel a lot. And so as we travel, and I know as I travel across the country, the one thing of all the travel I did this year was the congressional delegation visits, to going to Capitol Hill and speaking with lawmakers. What I found interesting is that participating in democracy in that way behind the scenes is what we're going to get what we need in our communities. Because while we're on the front line saying and advocating for everyone on a whole, the backroom deals are being made for those communities that are more affluent, for them to get all the amenities, all the access that they have, the new public health center in their office, in their home, in their neighborhoods, access to whatever amenities it may be to improve health. The backroom deals are being made, so it's easy to say, oh, those other people don't need this. And why don't they have that? We saw it in the last gubernatorial race when the candidates came out to speak with us, where they just couldn't understand, well, why are the Black people obese? Because we can't necessarily go out to walk if our neighborhoods aren't safe, or if the infrastructure is not the same as it is in other neighborhoods. So there's a whole dynamic that we realize that your zip code matters. on your health outcomes. And so when we start to play the game, because I'm convinced now that it is a game, it's a game of chess, to be able to maneuver to get the things that people need in communities that are disinvested.
Thank you. Oh, super fast. I'm gonna sorry, I want to make sure that we get to some of these questions. I'm anticipating potentially what you're gonna say, Cincy, and potentially Chris. So I'm gonna play off what Dr. Chalk just said. We have to play the game. The game has changed, right? We're in a totally different landscape, or we will be in 2 months. Actually, I think we already are. And so I'm going to ask one of the questions because it speaks to Project 2025. And I think Cincy and Chris, that you all can respond to this question and then add additional things. So what does Project 2025 mean for public health and health equity? And I know both of your organizations have created content to respond to it. So I want to ask that question, and then anything else that you wanted to say, feel free to add on to that.
Thank you, Karen. I'm going to just jump in here right now. And I think that the first thing that I want to say is that we need to understand that our healthcare system, and in fact, our society, was designed for the purpose that it's perfectly designed for the outcomes that it has. And that means that we have to understand that this is really not new. What we are seeing is a continuation of 500 years of colonization, of enslavement, of the kind of society that was built on the premise that not every human is actually human, right? So let's put that out there. This is not new. It may be new for people to actually realize that. And it also, I think we're affected by, after Obama, this idea that things were finally going to continuously get better, but what we saw was a real backlash, right? So it's important for us to understand that. It's also important for us to understand that we are still an extremely residentially segregated country. So that when people talk about zip codes, which is how, scientists study things, we're really talking about race and racism, because the overlap between zip codes and where people live is extremely racialized in this country. So we're still there, right? And I think what Project 2025 does is basically, outline in very clear terms that which I think in the past people were a little bit afraid to say out loud. And what we're seeing is a lot of leadership, supposed leadership, people saying things out loud that were never before accepted in polite company. But you know what? It is hurtful. It is very hurtful, but it's also very helpful to have it all laid out very concretely. So we can't hide behind euphemism. We can't hide behind, for example, it's not all explained by social economic status, right? It's actual anti-Blackness, anti-immigrant, and racist policies, and we can't shy away from that. The one piece of hope, though, that I do want to give people is that for those of us who were really fought hard to get the ACA passed, and I was one of those people, last time we had this president-elect in power, those of us who were working really hard to defend the ACA, we really didn't think we were going to be successful. And I was in an organization at the time that was working really hard. And what won the day is exactly what I think Karen now with Dr. Chalk or Dr. Stewart was the going to the decision makers' offices with the human stories of the consequences. At the end of the day, that is how we got the couple of Republicans to actually vote in favor of saving the ACA. We love to think as people in healthcare and in public policy that facts are going to win the day, but we are definitely in a post-science, post-factual existence right now. But what wins the argument, especially for the people that have the power with their votes in Congress or with their checkbooks or with how they're organizing resources, is making that human story that aligns with the facts. That's how we win.
Wow. So I jotted down some notes so I could keep myself honest. But the first thing that sprang to my soul is that America is a survival of the fittest contest. And it has always been a survival of the fittest contest because it is rooted in a white supremacist context and caste system. And we can never shy away from that fact. That's why what we say today isn't necessarily different as much as it is the ebb and flow of the pendulum swing, right? And so in this nation, we have seen across, the expanse of history, advances, and then we've seen regression and backlash. We truly haven't seen transformation, because transformation would require us getting our hands, souls, hearts, minds, needs, bodies dirty in the soil and uprooting that white supremacist root. And too often, we shy away from that level of authenticity. But that level of authenticity is required whenever there has been a catalytic movement in the United States. And these catalytic movements have been attached to either an accumulation of rights or an amassing of rights. It's because we have taken on that demon and that monster head on. We haven't shied away from it. And we have said how that act of dehumanization has either led to disenfranchisement, how it has led to certain groups or populations not being able to fully embody the myth of American access, because it's a myth for too many of us. It's not actuality, right? And so in Project 2025, we actually see some crystallization of white supremacist thought. We see it crystallized with pen and paper. And why I say white supremacist thought is being crystallized, because it goes at the essence of defining who is human. It goes at the essence of defining what is a family. It goes at the essence of how governmental structures should be designed only to protect those who meet the definition of white supremacist humanity. That's what it does, right? So it crystallizes and granulizes what is sometimes more ethereal in our culture. And so that's why it attacks the family unit. If it is not the family unit, that is through a certain lens. That is why it attacks rights. That's why it attacks resources around food and nutrition. It attacks resources around access to care, not just access to a particular care, right? Because reproductive health care is access to care. Let's put it squarely where it belongs, right? But it objectifies, if you will, which bodies are able to get access to care. And it says that certain bodies in this caste have access and other bodies do not have access to that care, right? And so what we in the NAACP have done, and we started this months ago. We started actually training our members across the United States, and we had a very large advocacy day in September, is to break down Project 2025 into smaller digestible bites, so that people would understand how does it attack access to healthcare? What does it propose in its changes around Medicaid, around the ACA, around Medicare? How is it trying to go after some of the protections or I would say additional benefits that we've won through the IRA, the Inflation Reduction Act, the government's right to negotiate drug prices and to cap how much seniors spend out of pocket on their prescription medications. We've helped people to understand how it would further gut and somewhat already anemic farm bill, right? Where SNAP or the Supplemental Nutrition Assistance Program would not have full funding to meet the need across these United States. This is not a need that is only impacting Black and Brown communities. Americans are food insecure and are hungry, more so than they ever have been in recent history. But yet we don't see appropriate funding levels for SNAP or appropriate funding levels for WIC. And this is all laid out in Project 2025, or how it seeks to define that children can't have access to food in the summer summer unless they're in an actual academic program, because feeding kids is somehow criminalized, again, dehumanizing certain bodies and certain persons in a caste system. So it's very important that as we think about how to fight the fight, because we're going to fight the fight. We're going to fight the fight. Nowhere in our history have we ever rolled over and died. Okay, let's make that really clear. We are going to fight the fight, but how do we fight the fight, right? And I love what Cincy said about stories, right? Narrative power, because what, you know, Dr. Chalk and what Dr. Allen were basically saying is we have to be able to leverage our community wisdom. We have to be able to leverage our own voices as power and take that power to power and speak truth to that power with our power, and to demand certain accountability of that power, and to demand access to certain rights and assurances, because that's what government is supposed to provide. And assurance, right? And so it's never that we ever knew that we could totally rely on government, because it's never been accountable, but government will only operate in its assurance capacity when we hold government's feet to the fire. So that's what a lot of these efforts have been about, teasing apart Project 2025 and creating action plans and getting people mobilized and activated to be able to take the fight to where the fight is.
Thank you for that, both of you all. So I think so far from what I've heard, our field has shied away from really talking about where we are. And they put out Project 2025 a long time ago, and you know, it's been being built. And so I really appreciate that. Dr. Chalk and Dr. Stewart Allen, I want to ask this question directly to you both, because of where we are. We're all three in Louisiana, if I'm not mistaken, which some people have said is the incubation sort of like laboratory for Project 2025. And I'll be honest, I totally agree with what you said, Dr. Chalk, about learning from our ancestors, how we have to build and strengthen our communities and rely on each other. I don't know how I am with doing the whole political process or interacting with our political leaders as you described. And so I think what I want to know really, and this is actually a question from someone, not just me, but what I want to know is, how do you interact going forward with this as conservative policymakers? But I don't think it necessarily has to be Republican or Democrat. I think it could be any policymakers. I don't think the label matters, but policymakers that are in this time and potentially agreeing with things like Project 2025 or are afraid to go up against things like Project 2025. How do you all suggest we interact with those politicians and policymakers?
I'll go first on this one. I guess I want to kind of go back and reflect a little bit on how we were successful, have gained momentum and been successful in similar situations in the past. And so I was speaking to one of my colleagues who kept talking about changing people's minds, changing the politicians' minds. And from experience, one thing that I learned is that we aren't going to change people's minds. We aren't going to change their ideology. And so what we have to do is change our approach to how we engage with them, how we interact, and what our expectations of these leaders and policymakers are. I mean, their job is to represent all of the people, not just the segment of people who may have elected them. For example, President Trump will be the president of the United States, which means he will be our president, whether we voted for him or not, or whether we chose or choose him even today or not. He will be the president of the United States. And so it is really important that we not shy away from these tough conversations and being deliberate, very deliberate about how we engage. One of the most important and effective things that I have learned over these years in my work is that organizing, coalition building, coming together, finding those across the spectrum, keeping in mind that there are many people, many organizations, many policymakers who don't agree with Project 225, who don't agree with the white supremacy mantra, who are not aligned with the conservative ideology. There are many people who don't, who aren't. And so it is important for us to build alliances, to build power, to build our strength. And this is the time how we got the Affordable Care Act and how we saved it in the last Trump administration was using that approach. It was organizing, it was coming together and collectively advocating, bringing to bear the power of the people. Remember, the power of the people is still, it still exists, and we still hold that power. We cannot abdicate our power to those in position, because those in position are there temporarily, right? And so it is up to us to build this momentum to make sure that they're there temporarily, to make sure that come midterm in 2 years from now, we change the dynamics of the Congress. We change the makeup of the Congress. We take back the power. We make sure that Trump is a one-term president. So these are the kinds of ways, some of the kinds of ways, but also being even more specific and more concrete around what are our demands. What is it that we, the people, want and that we demand of our elected officials? And bringing to bear the power of the people. We have seen this work time and time again. And so we will see it work again in this administration.
And Alma, I just want to add to what you're saying, because I know you've been there. You've been at the Capitol. And so what I'll add to that is that who you are as a person when you're meeting these policy and decision makers, knowing you as the person and as the professional that has valid and reliable information, and finding that common ground to bridge those gaps. That's how we succeed at this, because I don't care what color you are. If there's some common ground that we have with each other, we can make this work, and bringing that humanistic approach to it. Because what I have learned is that elected officials, their persona in front of the camera is much different from their persona when you're sitting in their office. And I'll just add this caveat. I'm not sure if it works like this with the state legislature, but I do know that on the national level, every time you send in a request or you make a phone call to that congressional office or request a visit, that visit is documented, and whatever that statement that you may have made in support of something to your congressional delegation, by law, it is logged in, and it goes a part of that congressional record. So when folks say, write your congressman, call your congressman, you may feel like that's not doing anything, but yes, it is important. It is another way of participating in democracy other than at the voting poll.
And I want to add one more thing, since you asked, Karen, you made this included in the question, a statement about Louisiana. Louisiana is similarly situated to that of the national landscape right now, in that we have complete control at the invested in one party. We have a governor who is a Republican. Our legislature is Republican and supermajority. They hold a supermajority. And we have all of the elected officials, statewide elected officials in Louisiana are Republicans. So I think that Louisiana is somewhat unique in that regard, but I also think that because Louisiana has such strong leadership in the national scene too, with the Speaker of the House, the Republican Party chairperson, we have very strong leadership in Congress, also coming from Louisiana. Mike Johnson is from Louisiana, a small rural town in North Louisiana at that. And so it places us in somewhat of a unique position to leverage that, to leverage the fact that Louisiana is the least healthy state in the United States, that we have among the worst health disparities and inequities when you think about maternal and infant mortality, for example. So we should be in a position to be able to leverage, in fact, having these leaders, regardless of their party, okay, so they're Republican, but you are representing the least healthy state in the United States with some of the worst health inequities in the nation, and you're holding these substantial positions of power. How is that going to benefit the people of Louisiana? That is the question that I ask. How is that going to benefit the people of Louisiana and improve the quality of life for people in your district?
Yeah, thank you for reframing it that way. I've never thought of Mike Johnson in that way, but I appreciate you reframing it. And I've always thought that places like Louisiana and New Orleans is where leadership should come from for these types of equity changes, both health, social, economic, all types of efforts for equity and justice, because we have some of the most level or the highest level of inequity in our country. So I appreciate that. I want to combine a couple of questions that we have gotten into one, given our time constraints. This question asks, with the devastating news of another Trump candidacy or administration, many are feeling a renewed sense of urgency and fear for the future of public health and human rights. What steps should we take to safeguard progress in health equity, reproductive rights, LGBTQ+ rights, and racial and social justice? So I think we have time to respond to this, but we'll see what happens. But yeah, what safeguards, what should we be doing right now?
I'll start with saying that, like, what we've all been talking about, we've already kind of answered that question, right? I do want to reinforce one concept, though, and I learned this from Anton Gunn, who many of you know. He's a big leader in health equity. He said it very concisely. He said, facts tell, but stories sell. And I think that needs to be kind of like tattooed on everybody's, like inside everybody's brains, because I also really appreciated in the chat the fact that, you know, data needs to have a heartbeat. And it's true that we won't necessarily change a person's ideology, but I think we can change narratives so that those in power realize that it is in their best interest to be more understanding and expansive of the humanity of everyone that they represent. And so I think it's one of the things, though, that we have to do a much better job of is the cross-movement coordination and support, right? So I'll give you the example. Like, we are, you know, we work on health equity issues, very focused on, you know, a couple of particular areas: repro rights, maternal health. How do we change the healthcare system so it pays for the things that actually work and that people need? But we also know that the biggest challenges right now, in addition to repro, are going to be against immigrant and LGBTQ communities, right? So it is imperative that we work more closely and coordinate with those. You know, we're not going to become experts on those issues, but we need to be there at every step, you know, helping across the whole movement. There's going to be, especially because of scarcity and the scarcity mindset, a lot of kind of competition, and that what they want us to do is to divide amongst our, you know, divide each other, and that's another way that they win. And we need to be very, very aggressive and proactive about making sure that we are doing that, you know, reaching out across particular niches or issue areas to promote and push forward that we are all human and we all deserve dignity and health and respect as a broader movement, not just within narrow it's like we talk about in public health as like health and all policies. Well, this is like we need to be fighting for health equity across all the movements, because the unity is what's one of the things that's going to give us the momentum and the power that we need.
And I'm going to say call to action. Now is the time for a call to action. If you live in a community that is suffering the effects of the urban heat island effect, plant a tree. Change happens incrementally. And so collectively, we can all make a change in our small part of the community. And I see that change occurring all across this country, where folks and communities are coming together to plant gardens that provide access to food care in those areas that are food deserts. I see folks coming together, creating solar hubs, resilience hubs, and putting that money back into the community and compensating people for their time when they're at community meetings and removing any barriers to participation. So from a community level standpoint, you can't complain. Learn what you can learn. Realize that the political determinants of health are real, the environmental determinants of health are real, and they affect our social determinants of health. So do something. Don't just sit on the sideline and complain that, oh, they should have done this or they should have done that. Because right now, the way I feel, if someone says they should have did this and you didn't vote, then I don't want to hear from you, because you had the power to say something and you chose not to. So, or that it doesn't affect you. You have to see yourself in this process and beginning to make change. And when people call you to help our youth throughout the summer, throughout the fall, whenever, you need to answer that call, because our children are watching us.
Yeah. Public health can't be a dirty word. And increasingly across the last 4 years, public health became a dirty word. And what I mean by that is it got saddled with this anti-government baggage, and public health was seen as overly intrusive into people's lives. We need to reframe, redefine, and reclaim what public health is. It literally is everything in our society, our social networks, in our environments that shape and influence who we are and our health outcomes. We have to help people understand about, do you have access to clean water? Look, I live in New Jersey, and we went through a very protracted but successful in some ways fight against lead in our water, right? The city of Newark having to replace pipes. It happened for my family, right? We lived in these communities for years, and finally it came to a head, and there was an outcry, and there was not only an outcry, but an organized effort within government and outside of government to demand accountability and to get those lead pipes removed ahead of the national timetables, right? And like I said, it hasn't been a complete success, but it is an example. That's public health. Or whether or not we're talking about, what access do you have to care in your neighborhood. I used to be a safety net hospital health executive. And the only reason people listened to me during the pandemic is because I refused to shut up. I told stories. I told stories about myself as a Black woman physician, as a Black woman healthcare executive, and I was tired of seeing people dying around me and on my watch, and no one in the federal government was helping us in the ways that they needed to. I was tired of having to bear that burden, and a part of that burden was losing my own father, right? Or having a sister have long COVID. So we need to help the public understand that public health moves oftentimes at the speed of narrative and storytelling, when we can help conceive of what it is, and then we can help create the vision for how we move forward, how we organize, how we catalyze our communities. And that led to, during that time of the pandemic, especially during the public health emergency part of it, it led to conversations about how do you advocate for yourself in your doctor's office? It led to conversations about, do you have access to primary care in your neighborhood? Or do you have to go to the emergency room to take care of your chronic health conditions? Or are you going to the emergency room because you're unhoused or you're hungry or because there's extreme weather, whether that's heat or cold, right? That's all public health. I've sat across the table from other clinically minded providers who want to treat public health as a stepchild, as something that happens outside of the four walls of medicine, when that is the large majority of determining whether or not people have healthy outcomes. And so I think that is the battle first that we all have to be willing to fight, is because right now there is a questioning of public health. I am faced almost daily, whether I'm in the gym, whether I'm on social media. Dr. Chris, was it really worth it for you to take the vaccine? Do you trust public health? Like, we still have a lot of work to do, and we have work to do at a time when you're going to have an administration put forth voices that know little about public health, right? But be in positions of decision-making power and authority about public health. And so I constantly rest health equity in public health. I constantly rest racial justice in public health, because you can't plan for, design for, execute or strategize for health and well-being without understanding what's at stake, right? So I think that's important to do. And the last thing about what we can do, start local. Right. And so many of us have said this, but please start local, start in your neck of the woods. I love what Dr. Allen and others were saying and reframing Representative Mike Johnson, right, about how he's truly a man with an immense amount of power. And there was a question about why do people, quote unquote, vote against their interests? Because they don't necessarily understand how the ballot or the vote is directly linked to their health and well-being outcomes, their economic outcomes, their education outcomes, right? And we need to help people understand that. And I am going to go partisan little p, right? We don't do partisan politics in the NACP, but I want to show you the power of storytelling. Frequently in Black-led urban communities, you hear certain of those who are in the conservative movement say, why don't you vote out your mayor? Why don't you vote out those who are in charge? Because you still have certain levels of crime. You still don't have the level of economic opportunity that you have. But rarely do we see that narrative spun on its head, and to ask those in states that have bottom-feeding health outcomes, right? Why don't you vote out those in power? Because your citizens and your relatives are still dying disproportionately. You don't have access to high-quality education in the ways that you should. You don't have access to the full economic menu of opportunity the way you should. And that's a narrative shift in frame. So that's the other thing that we need to do in our local environments, is interrogate the narratives that are being said and gut check them. Say, does this hold water in my personal life? Where am I? Where am I falling in this system? And if you are suffering in this system, the way for you to change from suffering to transformation is to be able to hold those accountable who have had the purse strings, that have been in power, and who have actually, if you will, executed on your suffering.
Well, first, let me acknowledge that Cynthia Hernandez-Cancio had to leave. She had to do another webinar right at 3 Eastern time. I do want to acknowledge Dr. Stewart, if you have anything that you want to add before we wrap up. We've had a very robust conversation. I think you've changed my mind on some things. So if there's anything you want to add, and then I'll wrap things up. Oh, you're muted, sorry.
I would just add that I appreciate all of the comments that were made today. I think that they are very indicative of how we need to be thinking about this time and space that we're in. I just would like to encourage everyone to, seize the opportunities. We can focus on the negatives and the doom and gloom and what we want, the way we want things to be, or we can focus on the realities of what we have and the way that it is. And we can make the adjustment on our part, on our end, to navigate this environment, this current environment, and to still have some gains and make progress even within this environment that we're in. So my words to everyone is, Don't give up. Don't lay down. Don't be discouraged. In fact, this should be more motivating and encourage you. I think Angela said it a few minutes ago. This is a call to action. This means get up, show up, and stand up. Speak up. Do your part, and we will see progress even within this current environment.
All right, someone in the chat said we can be strategic, and I think that is what we will have to do. I thank all of you all for your participation in this panel. And I'm gonna, say that we should do this again in January or February as things continue to move forward. So thank you all. I want to make sure that our audience knows that our next event is that we want to highlight is in April. We'll be hosting a film festival, Breakthrough Health Film Festival at Tulane, April 6th through 8th. But I really think before that time, we're gonna have to do a webinar or something to get back at this topic. So thank you all for being here. Follow us on social media, and everyone truly take care of yourselves. Bye-bye.